Hi everybody, Dean Katopsky at Performax Health Group. I wanted to talk about a classic example of symptomatic treatment. We've got Judith here. Judith has been gracious enough to let us talk about her case here a little bit. So you came in with chronic left-sided hip pain. Knee pain was bugging you a little bit?
Hip and calf.
Hip and calf, yeah. So and back. So basically after my assessment, we determined that if she was disky, it's not hugely neurologic. By that what I mean is the disc isn't pressing on the nerve enough to be creating the bigger trouble here. There's a bigger problem at hand. And from your history, you said that you'd had a bunch of different kinds of treatment.
Chiro, massage therapy,
physio. Right, IMS, I think you said you had some too?
No, never.
Just with me? So I was lucky enough to introduce her to IMS. So here's what I wanted to talk about. So when Judith came in, she was quite weak through, so she came in with a rotation, and I talk endlessly about this all the time. She came in with a pelvic rotation. She was rotated on the right, the nominate was rotated anteriorly, but the pain was on her left. Now, we talked about the fact that my case in point here is that the vast majority of your treatment was on which side?
My left.
Your left side. So that was the symptomatic side, but in fact, the pelvis is out and torsioning on the right side and creating a problem on the left. So she's symptomatic on the left, and the reason we know this is because it's been 5 treatments now?
Yeah.
5th treatment. And we're percentage-wise, how much reduced pain?
Oh, I'm like 70% feel better.
70% better in all aspects, increased function to a certain degree, less pain.
I wasn't able to stand up straight.
Yeah, you laid down on the table beautifully today.
Yeah, I couldn't.
So I'm not going to take you through the testing. I just tested her again. She's balanced. I tested her hip flexors, which is just quickly, it's a psoas test. We biased hip flexors. She's super strong on both sides. She can resist me very well. We did use the dynamometer. I haven't retested her. I know she's stronger, but I can get those measurements. You feeling stronger through that test? Couldn't hold me up. So my case in point is we've got a patient that's got a chronic history, left-sided low back pain, hip pain. She's had multiple sources of treatment. No relief whatsoever, and in my point and opinion here is everyone is completely off the mark. Not to discredit her past therapist, but this is exactly what happens when you treat symptomatically. Okay. Once again, she came with the right rotation. All we've done is balance the pelvis and open her back up, meaning mobilize her back a little bit. That's it. With a few little exercises just to start bringing her core power in. By the way, just aligning her and mobilizing her brings power to the musculature anyway and reduce pain. So point being is this: you need to, first of all, when you assess people, you need to find the source, or you'll never fix the problem. Secondly, you need to have a meaningful system that will create improved function overall that's durable, and probably, as importantly as all that, you got to not follow. You got to realize that pain is a lost leader. Pain will trick you, okay? And symptomatic relief gets you absolutely nowhere. So we've got
Can I make a comment?
Of course you can.
On my right side, my quad, I could not even lift to do a quad stretch before. My quad was so, and really bunched over to do that. And like today, I can just lift my foot and do a quad stretch.
So part of having a rotated pelvis, which is what Judith had, was when you bring that pelvis forward, you actually shorten down what's called the rectus femoris, which is one of the 4 muscles in the quadriceps. So part of force balance technique, which is what I wanted to get to, is reducing quads tension. So I mean, overall, you're going to start feeling a heck of a lot better. So check out force balance technique. It's my algorithm. It's soon coming to a clinic near you, hopefully. The website's performaxhealthgroup.com. We've got a ton of videos there, some excellent stuff in what we're getting through in regenerative medicine, and my new algorithm, force balance technique. Thanks very much.